it's nice to see our friends from Titusville Area Hospital this morning. Holli Wolfe joins us. Good morning, Holli. How are you? Doing all right?
Good morning. I'm well. How are you, Luke?
Good, thank you. You brought in a very special guest this morning.
Yes, I did. This is Dr. Fred Teribury. He is our interim hospitalist. So I wanted to bring him on, and he could give us some tips and some advice about the coronavirus.
Very nice. Good morning. Good to see you.
Good morning. Nice to meet you today.
Before we get into it, tell us a little bit about yourself.
Well, my name is Fred Teribury. I'm a medical doctor, internal medicine. I'm also known as a sportsman's doctor because I do a lot of outdoor shows and do a lot of sportsman stuff.
Oh, cool.
Aside from that,
Titusville's a perfect place for him
yeah,
to be.
perfect place.
Yes.
I started off in
You
the United
enjoyed it
States
yourself?
Army.
Oh, did you?
Yeah. I started off in the Army. I was in the infantry for a while, went through the Special Forces selection course, and became a special operations medic.
Wow.
That's where I got introduced to medicine. So I've traveled around the world doing that quite a bit. And then, one of my, I don't want to say hobbies, has been chemical and biological warfare. So I actually was trained in Aberdeen Proving Grounds at the Chemical Biological Warfare Center for, talking about different forms of masks and personal protection. So
Wow.
Yes, so we are really fortunate.
my
to
kind
have
of my
him.
thing.
Yeah.
You're the guy now.
He is. He's our go-to.
Well, welcome.
Thank you.
It's
Glad to
quite
be
a
here.
background.
Yeah.
So you've seen it all.
Well, I wouldn't say all.
Yeah.
More than most.
Yeah.
I always wanted to be on the space shuttle. They told me I was too tall. So,
Wow.
no, just a joke.
So, kind of set this up because we were talking before coming on. There is so much information that gets thrown at us on a daily basis.
Mm-hmm.
Can you? I don't know if it's even possible to do this. Can you boil it down? What are the knowns for sure today?
Well, I'll just start off with the basics. We're talking about coronavirus called Covid-19. And I like to point out that this is not a new virus family. It's a different strain of a well-known family. There's no conspiracy that totally new virus has been created and it's taken us down. It's a deadly virus to certain groups. Mm-hmm. I would point out that obviously people over 65 and people that have immunocompromised conditions and people that have pre-existing lung and heart diseases are much more prone to suffer dire effects from this virus. The vast majority of people, 80% plus, asymptomatic or not even symptoms bad enough to actually be seen by medical people. So there's a big question as to how long the virus has actually been here and how many of us have already had it.
Does that come down to testing then?
Testing, yes. The thing with testing, there's two different kind of tests. There's acute test to see if you have it actively now, and then there's the test to see if you've developed antibodies, which means you've had the virus and you're recovered. So we're presently in the phase where we're testing to see how many people are sick, and there's something called sampling bias. If you're not familiar with it, we're suddenly doing hundreds of thousands of tests. People are seeing, more and more people are getting the virus. No, actually, we're doing a lot more tests and we're catching a lot more people. So they're going to start understanding what the true penetrance in the population is for the actual disease.
So right now, what the concern is percentages. They don't look good because your testing is limited, right? And so you're seeing these spikes, right? And the death percentage with the testing, I mean, they're kind of going hand in hand at the moment, right? With the the smaller sampling size.
Yes, when the testing first started, we were only testing the people that had the most symptoms
And they had
to
have
try to catch the
exposure
positives.
and those types of things.
We weren't testing what they call the walking well. People that might have had, I think I have a little cough and a little fever and a little body ache, we weren't testing those. So those people likely had the symptoms resolved. Now they're better. So we were initially only testing the sickest people. Therefore, the fatality rate was seen as higher, but that's also a bias of the way we were testing. So, when it's all said and done, the epidemiologists are going to need to test samples of the population to see what portion of the population actually had the virus and what portion actually expired from the
So
virus.
how long can you wait for something like that and then test people and still get some sort of a result?
That you mean for the
That you maybe
long-standing
carried it.
antibodies? That there's questions on that right now because they haven't solidly developed the correct tests, to my knowledge. There are dozens of tests coming out, and they need to be validated and to see. So that's going to be a moving target. It should definitely be 6, 12, 18 months. We're not talking testing 5, 10 years from now, because your whole population changes in that time. So it's kind of a moving target, but I think they're going to be moving on it because people are looking at it. This is the main issue.
Are you surprised or amazed at how quickly things have moved since the beginning of the year?
I am amazed at the reaction that this virus has received from the general public and the powers to be. We've had viruses every year. These viruses are part of the ecology, the biome of our planet. Viruses are part of it. There's always new viruses being developed and coming, as in they're evolving, they're changing. So there's always different viruses going through our populations. And this particular one just happened to be the one everybody jumped on.
Holly, in terms of testing, where does the hospital sit right now with? We've heard, some doctors calling their patients saying, "Hey, we're going to hold off on, testing you or looking at you for other health-related things until things settle down." Where's the hospital right now with meeting with other patients?
So our offices are open. We are seeing patients in the hospital, at the Rural Health Clinic. We're seeing them in the Ovema clinics. So we are seeing our patients right now. We always, of course, if you have flu-like symptoms, we ask that you call in. You just don't walk in and want a visit, because they can assess you over the phone if it's flu-like symptoms. But we are seeing all of our other patients otherwise in the clinic.
Is it something that...
in the clinics, I should say.
Clinics,
yes.
Just contact your doctor's office and have that conversation?
Absolutely,
okay.
Yep. And when you call the physician's offices, you let them know what your symptoms are. And, initially some of the wellness visits, they're holding on a little bit, especially if the patient was nervous about coming in, but they are seeing those patients, and we're doing everything possible and following all the CDC and Department of Health guidelines at the hospital as far as universal masking. We're checking all the employee and patient temperatures as they come in through the door. So we're following all those guidelines and doing the best that we can to ensure that we have a safe environment for them to come into.
Doc, going back to all this information that gets thrown out on a daily basis, do you ever look and say, okay, there's a little bit of truth here, there's a little bit of truth here, if we can just figure out how to get it all in one spot?
Yes, there's partial truths and there's a little misinformation on a lot of individual subjects. I think as a whole, we're doing a pretty good job of things. I do believe a lot of people don't understand why we're doing certain parts, like why we're wearing the cloth face mask, why we're wearing this mask versus that mask, and who should be wearing what. There's some confusion there.
Is there a good place to go to get that information?
Actually, the CDC website has a lot of very good information. Okay. They even have. They even have an explanation and a diagram on how to make your own masks the best you can.
And I've been posting a lot of that information on our hospital Facebook page.
Okay.
So, and I did put that one on there as well. So I've been trying to put that information out for everyone that follows our hospital Facebook page, so they can see that as information as well.
So go and like the page, and you can
That's right.
keep up to date with everything.
That's right.
And you're not searching everywhere; it's all right there.
Yes.
And it's I think people are trying to do the best they can. But you'll still run into somebody and the mask isn't on right, or it's not the right kind, or they're wearing a full suit and
yes, and that's that's what's scaring people when they see those types of things. When you're walking into Walmart and you think, whoa.
Well, Walmart has scared me for many years.
yeah.
Suit or not, right?
Yeah.
It'd be nice to go back to a day where we can just where we get scared of somebody wearing pajamas there.
Yeah.
But now
Right?
it's, yeah. Here's the other thing, and this irritates me, but I don't. Maybe it's just me. People talk about the new norm, the new normal, the new normal. Is there a day where we can go to a baseball game or a football game, or is that going to completely change?
Oh, that's coming. Once things settle down, and trying to avoid certain topics.
Sure. And I don't mean to put you in that position.
But yes, it's
Okay.
coming. This is another virus that's going through the population. The fatality rate is, I believe, much lower than what people are letting on, because it's a population-based
It's
epidemiological question we're looking at here, not a personal question.
But that you're talking now. Just it's time and getting the data, right?
Yes.
Yes. We just have to do that, and then you can actually have a better look at everything, right?
Yes,
Okay.
yes. I mean, one of the things that want to be pointed out is that the common flu, influenza, kills an average of 50 to 60,000 people a year in this country. Every year, same time frame, and we don't really hear anything about that.
Yeah.
And it's kind of frustrating.
We could spend 5 hours.
Oh yeah.
Talking
Yeah.
here. Let's do this first. You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel, and listening to it on the Allegheny News Talk Sports Network. Holly, I want to bounce to you real quick. We're able to talk about this?
We are able to.
Set it up.
So we're finally moving into the next phase of an ER project. So we have some photos to share with everyone. Phase 2 completed last week. So this is the area that previously had curtains for walls and the doors. So now we actually have the glass doors. It's separated by walls. There's no longer curtain separators between the beds. So this is the best part of the project.
Look at
and what
that.
I've been looking forward to. Yeah. So where you see the glass door there, it was a curtain. So
Wow.
it's super exciting to see that we're making some progress, and we're moving, like I said, into phase 3. So right now, all of our emergency room exam rooms are open, which is good. At that point during this process, the last 2 months, 3 of our exam rooms had been closed because of we're obviously remodeling them and renovating that space. So we're happy that all 6 rooms are up and ready right now. At some point, that 2 of the rooms will then be renovated, so we'll be back down to 4. But 4 of the rooms are completely done now, so we just need to move on and keep going with the construction, and hopefully we'll be done by end of the summer, early fall.
That's awesome.
Yeah.
Congratulations.
Thank you.
Not quite there, but you're pretty close. That's walls.
Yeah, I mean,
who would have
seeing
thought?
that, yeah, I mean, so the patient privacy has always been a huge concern of ours, and curtain
For you, but for
separators
those in there,
just did it.
sometimes it's some entertainment while you're waiting for the doctor to come in, right?
Well, it could be, yeah.
Cousin Bruce, is that you?
That's true. But, obviously we don't want that to happen. We certainly don't want anyone overhearing conversations in the emergency department because we had a curtain for a wall.
Yeah.
So.
No, that looks amazing. Absolutely amazing. So congratulations on that. Has it been difficult the last 6 weeks working on this project? Or?
Our volumes have been very low, to be honest with you. Everybody has been doing what they should be and sheltering in place, and we're just really not seeing many patients. So,
And listen, I got to commend the Titusville Area Hospital, Meadville Medical Center, the transparency and the openness and these conversations. It's been totally amazing. So congratulations to everybody.
Thank you
on that. And it hasn't been like scare tactics. It's just been here's information. Here's the snapshot of Crawford County.
Yeah, and really, I mean, that's our goal. We don't want to hide anything from anyone. So and we feel the more informed the public is on the situation, the better.
Yeah.
So,
Doc, for you, what have you enjoyed about this area?
Well, I'm come from this is actually a big city compared to where I come from. It's unfortunately, when I started working here, the shelter in place and, all this was already in place, so I haven't really seen a lot, but I really like the people here. It's good people, they're interactive, they're friendly. I've been well received.
What activities do you enjoy? You said you enjoy following like the outdoor sports.
Well, I generally do a lot of hiking.
Okay.
I go hunting, but mainly because my daughter goes hunting, and I just go along.
Good bonding experience.
Yeah, I did that stuff. Mainly outdoor stuff is what I like to do.
And people can still be doing that.
Absolutely.
I can't tell you how many times I've talked to somebody that's like, I got to stay in my house.
No. Best thing you can do. I mean, the actual science behind it says the best thing you can do is get outside and get fresh air. Going back to the Spanish flu in 1918, the people that had the greatest survival rates of the sick were the people that were actually in the tent hospitals, that were outside in the fresh air. Wow. So get fresh air. I mean, that's out there.
So if we're taking the dog for a walk, and it's been quiet at night, okay? I mean, you don't see anybody. I think the other night we grabbed our mask and carried it with us, but do we need to be wearing them when we're out doing that, or?
No. If you're actively coughing and sneezing, the whole idea of the mask over your face isn't to keep you from getting the disease or the virus. It's to keep you from spreading it. There's concern that the walking well are out there and they have the virus and they're spreading it. That's why they want to mask up, to reduce spread. If you're out in the general air, the air currents, there's unless you're stopping and talking to a friend face to face, you're not going to be interacting that way.
If you're going to the store, put the mask on.
Yes.
If you're taking the dog for a walk.
If you're outside and you're enjoying some fresh air, get the fresh air. Never mind the mask.
Okay, awesome. Well, Doug, it's great to see you and meet you this morning, and hopefully you can come back sometime. Holly, I always enjoy the conversations. You bring in wonderful guests all the time. Thank you for everything that you guys are doing. And last thoughts on anything?
No, just want everyone to stay healthy, and hopefully our numbers in Crawford County stay very low.
Yeah, and really the hot spots are your cities right now, right?
Yeah.
Pittsburgh, Philadelphia. But again, just kind of keep watching and go to the hospital Facebook page.
Yes.
And follow that.
There's lots of information on there. Yep. And the website as well. Our hospital website has we created a page for coronavirus.
So get the info. Holly, what'd you learn today?
Well, I learned that Dr. Teribury came from a very rural area, which I did not realize.
Yeah. Doc, how about you? What'd you learn today?
Not real sure. Met a new person and enjoyed the conversation. Learning. I like your Sasquatch poster, but
hey, there you go. I like what's everybody been saying? Be like Sasquatch during these times. Don't be seen. I don't know. Well, thanks for coming in. Thanks, Holly. Good to see you.
Good to see you.